Hi, my name is Kiana Rush. I'm entering quarter 7 and I'm going to be one of the tutors for pharmacology. Today we're going to be covering adrenergic and anti-adrenergic drugs. All right, so I'm making these review sheets on Google Docs. They should be available to you on Canvas, hopefully, or shared with you in some form. I like to combine my note-taking for pharmacology with other classes. Physiology pairs really nicely, actually. It'll help you better understand the drug's mechanisms of action and also kind of be multitasking for board review. So let's jump right in here. Okay, if I can get my annotation to pop up. So feel free to email me if you ever need me, have a question. I usually can respond within a day, and there are no stupid questions, so feel free. So the general notes are starting here. Catecholamines are synthesized from the amino acid tyrosine, and I only remember that because in my notes, I had drawn a little kind of doodle of a cat. So this is gonna be a cat. My cat is actually sitting next to me right now. There she is. Her name is Gwen Stefani. She came with the name. Anyways, I love cats. I'm sorry. I remember that catecholamines are synthesized from tyrosine because of this. Sorry, that is not a very great cat, but there's my cat representing catecholamines, and here are some tears coming from the cat. I should have made it frowning. Maybe draw yours frowning if you choose to do this. So I remember that tyrosine creates catecholamine from the image of a cat crying. You probably never really see a cat cry like this, so kind of unforgettable. That tyrosine is then converted to dopamine, and dopamine is then converted to norepinephrine, and norepinephrine is a catecholamine. So there you go, full circle. Tyrosine to dopamine, dopamine to norepinephrine. Norepinephrine is a catecholamine. Cool. So now we're going to go over some mechanisms of action for various adrenergic drugs based on their receptors. And this page is USMLE 234, and it has a good little summary. I would highly recommend it. So beta 1, you find those in the heart. Makes the heart beat faster, makes the heart beat harder, kind of just increases the fight or flight response. But yeah, you find them in the heart. Beta 2, you find them in the lungs. It's going to vasodilate. Sorry, these are lungs, by the way. Very small set of lungs. It's going to vasodilate and bronchodilate, which is important. So beta 2 bronchodilates. I remember you only have one heart and you have 2 lungs. Pretty easy to remember. Beta 1, beta 2. Alpha 1. Alpha 1 are found a few places. They'll increase vascular smooth muscle contraction, so they're going to increase the blood pressure. For alpha 1, increase blood pressure. Pupillary dilation, which is mydriasis, so alpha 1 will make the pupils bigger. Intestinal and bladder sphincter contraction, because it's creating that sympathetic response through alpha 1. So fight or flight, you don't want to be going to the bathroom when you're trying to run away. Am I wrong? I don't think I'm wrong. So alpha 1, bladder, and intestines kind of stop their flow. Alpha 2, this is where it gets a little interesting. This is where you need to kind of listen up. Alpha 2 is different. Alpha 2 is kind of a negative feedback system. Alpha 2 will reduce sympathetic outflow from androgens. It's going to lower insulin release. It's going to lower lipolysis. It's going to decrease aqueous humor production from the eye. It's going to increase clotting and platelet adherence, and also will induce pupillary constriction, which is meiosis. I didn't type that, but you should probably write it. It's meiosis. Alpha 2, meiosis. Alpha 1, mydriasis. Remember, alpha 1 is sympathetic, and it's making your pupils really big, right? So you can get all that light in, so you can run and you can see. Alpha 2 is reducing that sympathetic response, and so it's constricting the pupils, okay? I'm actually going to scroll down. I'm going to clear these images out for 1 second. And I'm going to scroll to this image below, just so I can kind of describe the differences between alpha 1 and alpha 2 a little bit better here. So this image is actually also in your USMLE, found on page 235. I would highly recommend it. Alpha 2 is right here. Okay, that's the one we just talked about. See how it's negative feedback coming to alpha 2? It's the only one that does that. Adrenal receptors, alpha or beta. Okay, so down here, if it helps you to maybe write in that this is only going to be alpha 1 and then beta 1 and beta 2 for the receptors that are on the postsynaptic membrane, that might help you keep it a little more clear. Wink, wink. So just to kind of reiterate full circle here for that whole physiological mechanism of adrenergic receptors, we have the tyrosine coming in, right? That tyrosine is going to form a catecholamine. So it's made into dopamine, and then there it is, norepinephrine, our catecholamine. So remember that picture of a cat crying. Remember that catecholamines are synthesized from tyrosine. All right, so that norepinephrine, a catecholamine, is released from the presynaptic neuron. And if there is too much, it feeds back to the alpha 2 receptor on the same neuron, okay? So it let out some norepinephrine. It senses itself like, whoa, I just let out a lot of norepinephrine. I should really hang on for a second. And that's what alpha 2 does. It's kind of self-regulating for that presynaptic neuron, so it's not releasing too much norepinephrine. So remember, alpha 2 is going to decrease sympathetic outflow. Okay, trying to choose a color here. Albuterol. Albuterol is an adrenergic drug. It is sympathomimetic. And if we break down sympathomimetic, what does that mean? Mimetic. Oh, it's mimicking the sympathetic nervous system. So it's mimicking a fight or flight response, okay? That helps me anyways. So mimicking fight or flight. And I like to remember albuterol for one word for my word associations, and that would be acute. Albuterol is for acute asthma. So short term, acute. And where is asthma, you say? Oh, asthma affects the lungs. Beta 2, 2 lungs. All right, moving on. Another drug that's important to know is Salmeterol. And how do we remember Salmeterol? Oh, it's used for heart failure. It's used for cardiogenic shock, cardiac stress. Oh, long-term asthma and COPD. It also prefers beta 1 because it has all of those heart effects. But how do we remember that salmeterol is long-term and albuterol is acute? Well, I personally like to remember that salmeterol is long because Oops, that's not what we wanted. We need one with a hole in the middle. Salmeterol is long because it has the word meter in it. So it's long. Okay. Epinephrine. Epinephrine is a catecholamine. Prefers beta over alpha receptors. It's useful in anaphylaxis, so if someone's having an allergic reaction, you would use an EpiPen, epinephrine, asthma, or open-angle glaucoma. Epinephrine has significantly stronger effects at beta-2 in the lungs than norepinephrine does. So if someone's having like bronchoconstriction and kind of like that airway asphyxiation, that's why they use an EpiPen, is because it has significantly stronger effects at beta-2 than norepinephrine. So that's why it's an EpiPen, to kind of open up those airways in anaphylaxis. Norepinephrine, alpha-1 to alpha-2, and then beta-1, it's used in hypotension and septic shock. And remember, why is alpha-1 useful in hypotension? Does anyone remember? I remember that alpha-1 is useful in hypotension because alpha-1, the ones are more aggressive, and alpha-1 will vasoconstrict. And that's why it's more useful in hypotension, because norepinephrine works on alpha-1. So if someone has hypotension, activating alpha-1 will cause vasoconstriction and fix their hypotension. Phenylephrine, I honestly don't even remember seeing too much about it. I wouldn't worry too much about it. Maybe this ischemic priapism part, that's kind of specific. So what would that mean? Ischemic priapism. That means ischemia, there's not enough blood supply, right? Or the blood supply is blocked, right? And priapism means an erection that won't end. So this is, the blood supply is blocked and the erection can't drain. So if we induced alpha-1, it would increase vascular smooth muscle contraction, hopefully do something for those veins that are causing that ischemia, or that vascular that's causing that ischemia, and help drain that issue that's causing the priapism, and hopefully end it, because that can be very painful. Amphetamines. All right, so underneath the word amphetamine, you see here where it says indirect agonist, right here. That's because the rest of the drugs we just covered under adrenergic drugs are direct agonists, so they work directly on the receptor themselves. Amphetamines are a little different, and we're actually going to scroll down to the image below to talk through that. Back to my mouse. So amphetamines are indirect adrenergic drugs. And this is because amphetamines, you're going to see them twice here in this image. They're increasing the norepinephrine that is released from the presynaptic neuron. And they're also inhibiting the reuptake of that norepinephrine. So not only is more coming out, it's also not being taken back up. So it's kind of like turning on your faucet from like a medium normal drip to like high. And normally like your drain can handle like that medium drip, but now it's like it's high, it's overflowing, and your drain's just not draining anymore. It's just like there's norepinephrine everywhere. And that's kind of how amphetamines work. Not only do they increase the amount that comes out, they also block it from being taken back up. Cocaine, very similar to what we were just saying about amphetamines. It inhibits the uptake of norepinephrine, and it keeps more available in the cleft. Yeah, and so this is usually used as a local anesthetic, if it is used. Lidocaine, though, is much safer than cocaine and more commonly used than cocaine. Side effects of cocaine can be intoxication, and you need to be really careful in those people with heart issues, as they're more susceptible to having like a stroke or a heart attack from drugs such as cocaine, even when used medicinally. Also, there's a risk for dependence and abuse. Now we are going to move on to anti-adrenergic drugs, also known as sympatholytic drugs. And what does that mean? Sympatholytic. Sympatho. That probably means fight or flight. Lytic. That means to cut. So this is cutting off the fight or flight response. Sympatholytic, anti-adrenergic. Okay, we're going to scroll up for 1 second here. Just to review, the drugs we just covered were sympathomimetic drugs. So those were copying a fight or flight response. These are sympatholytic drugs, which are cutting off a fight or flight response. Great. So a lot of these drugs are alpha-2 agonists. And remember, alpha-2 is the only one that has a receptor on the presynaptic neuron. We will review again. Here's alpha-2. When a bunch of norepinephrine comes out of the presynaptic neuron, it's all concentrated here in the cleft. Some feeds back to alpha-2, and alpha-2 says, hey, stop releasing that. There's too much. So alpha-2 is sympatholytic in nature, if that makes sense. The receptor for alpha-2 wants to decrease sympathetic output by negative feedback, okay? As where alpha-1, beta-1, and beta-2 are all on the postsynaptic membrane. Great. So the first drug we're going to cover here is going to be Clonidine. You will probably see this one a lot, so get familiar. Clonidine is an alpha-2 agonist. It will reduce sympathetic outflow. It will lower clotting and lessen production of aqueous humor, such as in glaucoma. It can be useful in hypertensive emergency, ADHD, Tourette syndrome, and opioid withdrawal. Why opioid withdrawal? Let's think. So opioids, they will actually cause kind of arrest and digest response, right? So when someone's withdrawing from opioids, their body will actually throw itself into more of a sympathetic state. They'll be agitated. They will be angry. They will be sweating. And using an alpha-2 agonist can reduce some of those symptoms in opioid withdrawal, okay? Opioids put someone into kind of a chronic rest and digest state. The withdrawal kind of puts them into a sympathetic state. Using an alpha-2 agonist will reduce some of those sympathetic symptoms in opioid withdrawal. And Clonidine can be used for that. So I remember Clonidine through a very short mnemonic. C, lon, I, dine. Kind of silly, but it's how Clonidine is spelled. So lawn, I'm looking at as like someone's lawn, like their yard. And when I think about this mnemonic, I think about being on a picnic or something, and I'm having issues moving my writing, but that's okay. Being on a picnic and just not wanting to walk anymore because, you know, that's like fight or flight, being active. And Clonidine, C-Lon, I die. I'm like, oh, that grass looks really nice. Let me lay down and take a break. Let me reduce my sympathetic outflow, all that stuff. Just relax. And when you think about an alpha-2 agonist, reducing the amount of norepinephrine that's being released, you're probably going to chill out if you have an alpha-2 agonist. So Clonidine, C-Lon, Idine, have a little picnic, relax. Great. Amethyl-dopa, I would know pregnancy, one word there, pregnancy. Also, for the side effects of amethyl-dopa, I would just like to point out that direct Coombs positive hemolysis and drug-induced lupus are both examples of what? Where am I going here, guys? S-R. Kind of looks like a 5 for the S, but that's okay. HSR, so hypersensitivity reactions. So people can have autoimmune related reactions to this drug, so just watch for that. So that sounds kind of bad, right? Especially in a pregnant person. Direct Coombs positive hemolysis, I do believe, is a type 2 hypersensitivity reaction where antibodies are built up on the surface of red blood cells, which causes hemolytic anemia, which can be really dangerous. And drug-induced lupus, I believe, is a type 3 hypersensitivity reaction where antigen-antibody complexes are formed in the circulation and deposit other places, like you'll see them in like a butterfly type pattern, also known as a malar rash in lupus patients, and they'll deposit in the cheeks. Cool. All right, next. Xanadine. It's an alpha-2 agonist. It relieves spasticity, and side effects are hypotension, weakness, and xerostomia. So let's think about this. Why would some side effects of alpha-2 agonists be hypotension? Sounds like a great quiz question. Well, let's scroll down again, shall we? And kind of explore why these alpha-2 agonist type drugs could cause hypotension. Alpha-2 is right here, right? That alpha-2 receptor. Alpha-2. And if we're doing some negative feedback to the alpha-2 receptor from having too much norepinephrine, we're not going to release norepinephrine, okay? So if we're blocking alpha-2 and blocking alpha-2 and blocking alpha-2 and not giving it a chance, we're not going to release norepinephrine. Our blood pressure is going to get really low because we're really dumbing down that sympathetic response if we keep blocking alpha-2. That's why we're getting hypotension, orthostatic hypotension. Alpha-2 blockers, they can be good, they can be bad. Luckily, most people have problems with hypertension and not hypotension. So now we're moving on to another class of drugs, alpha blockers. And if we remember from the beginning of this video, alpha drugs do two different things. Alpha-1 will work on the postsynaptic membrane, right? And it will increase vascular smooth muscle contraction, increase pupillary dilation, which is known as mydriasis, because fight or flight through alpha-1, you want your pupils to be really big, right? Intestinal and bladder sphincter contraction, because you don't want to be going to the bathroom when you're running away from a tiger. Thank you, Dr. Schmidt. Alpha-2 will reduce sympathetic or adrenergic outflow. It lowers insulin release, lowers lipolysis, and aqueous humor production. It increases clotting and platelet adherence and induces pupillary constriction, also known as meiosis. So look at alpha-1. Alpha-1, increasing sympathetic response, postsynaptic membrane, alpha 2. Reducing sympathetic response, presynaptic membrane. We're only talking about alpha drugs right now. Let's look at the image below. So here's going to be your alpha 1, right? Alpha 1 is down here. Alpha 2 is over here. So alpha 1, sympathetic response over here. Alpha 2, negative feedback over there. I think we get it. Okay, drug number 1 for alpha blockers. Drug number 1 for alpha blockers, Phenoxy Benzamine. So this is irreversible. Okay. It's used in pheochromocytoma to prevent a catecholamine crisis. And pheochromocytoma, if you guys don't know what that is, it's a tumor of the adrenal gland and it will produce catecholamines. So norepinephrine, epinephrine, all of those things are going to put you into fight or flight mode. So it's kind of a tumor that puts you into fight or flight for no reason. Sounds bad. So phenoxybenzamine is used to kind of help with those symptoms. So then they don't have a catecholamine crisis, which would be like sweating, tachycardia, possibly a heart attack. I don't know, it would be bad. Definitely not good. So some side effects of blocking alpha 1 and alpha 2 would be orthostatic hypotension and reflex tachycardia. So when the drug wears off, their heart's going to beat really fast again. That's reflex tachycardia. But orthostatic hypotension, that means when they stand up, their blood pressure goes low. That's because we're blocking alpha 1 and alpha 2, okay, irreversibly. So they're not getting that norepinephrine response, and they're also not releasing more. Phentolamine, this one is reversible. I remember that this one's reversible because the drug name, it's just a little shorter. So I'm like, oh, look at this word. It's short, you know, it'd be easier to bring back. Could probably fit it in my Kia Soul. Yeah, this word, it's really long. It'd be really difficult to bring back. Probably need like a pickup truck or something. Irreversible, big word. It's as simple as you can make it. Yeah, but the uses of phentolamine, kind of important. It's reversible, but it's given to patients on monoamine oxidase inhibitors who eat tyramine-containing foods. It's also given for cocaine overdose. And cocaine overdose, along with MAOIs, so cocaine / MAOIs with tyramine foods, both are going to raise the blood pressure. Cocaine, just because of its mechanism of action, but people on MAOIs, when they eat tyramine-containing foods, one of the metabolites actually raises the blood pressure, and that's why they're not supposed to eat tyramine-containing foods. But phentolamine can help counteract that, so then the blood pressure doesn't go too high in these patients. So it's a non-selective alpha 1 and alpha 2 blocker. And hopefully from that image below, we know what alpha 1 and alpha 2 are good for. All right. Last drug to cover in this video, technically 2. These are alpha 1 selective, and alpha 1 is on the postsynaptic, right? So if I just wanted to put a circle around that here, I definitely could. Here's my alpha 1 down here on the postsynaptic, receiving some norepinephrine. Great. I like using a word mnemonic to remember prazosin, however you say it. So Prazosin is used to treat BPH. So prazosin. And then I spell prostate like this. Obviously, it's not how you spell prostate. But switching the way the word is spelled really helps me remember what the drug is for. So prazosin, prostate, BPH. That's what it's great for, benign prostatic hypertrophy. It's also used for PTSD and hypertension, and that makes sense for the hypertension, right? If you're blocking alpha-1 on the postsynaptic membrane, they're not going to receive that norepinephrine. Their blood pressure will stay lower. Some side effects. First dose orthostatic hypotension. I don't know what differentiates this drug from the others and why it only has that first dose orthostatic hypotension, but it does. Increases cholesterol and decreases the appetite. Okay, I have a few little review questions for you guys. Questions for review. Where are beta-1 receptors found? What drug activates them the most? Do we remember the mnemonic for beta-1 receptors? One heart. Yes, beta-1 receptors are found in the heart. And the drug that activates them the most? Salmeterol, used in heart failure, cardiogenic shock, and cardiac stress testing. It's also used in long-term asthma and COPD. And we remember that because salmeterol has meter in it, and a meter is long. Would a beta-1 agonist be useful in a patient with asthma? Maybe. Probably not, though. Why? Because the lungs have beta-2. Remember? 2 lungs. So a beta-2 agonist would be more useful in asthma. So something like albuterol could be used in an asthma attack, which is acute. Beta-2, 2 lungs, acute asthma, albuterol. Where do we find alpha-2 receptors? What are their jobs? Luckily, we don't have to stray too far to find the answer. Alpha-2 receptors are on the presynaptic neuron. What are their jobs? Their jobs are to regulate the amount of norepinephrine in the synaptic cleft and provide negative feedback to the presynaptic neuron so there's not too much norepinephrine coming out. So alpha-2, presynaptic, and negative feedback. Where do we find alpha-1 receptors and what are their jobs? Alpha-1 receptors are found on the postsynaptic membrane, and their jobs are very similar to any other adrenergic receptor. Specifically, they increase vascular smooth muscle contraction, dilate the pupils, and stop the intestinal tract from moving and also contract the bladder. So they're increasing the blood pressure by vascular smooth muscle contraction and stopping you from going to the bathroom when you're running away from a tiger. That is the job of alpha-1. And also dilating the pupils so you can see in the dark. Why is it useful to apply an alpha-2 agonist in glaucoma? Well, in closed angle glaucoma or acute glaucoma, we have this buildup of aqueous humor, right? In the anterior chamber of the eye. So using an alpha-2 agonist can help reduce the production of aqueous humor and lower the production in the eye, and therefore lessen pressure in the eye and reduce the complications associated with glaucoma. I hope this video was helpful, and if you have any questions, feel free to email me. My email is right here, and I hope that studying at home treats you well and you stay healthy. Until next time.